Welcome to today's webinar on understanding health insurance. My name is Monica Bryant, and I am moderating today's program. I would like to introduce you to the speaker for today, Nicole Jolicoeur, who is a staff attorney at Triage Cancer. So with that, for the sake of time, I am going to turn it over to Nicole.
Thank you for the introduction, Monica. I look forward to speaking with you all about health insurance in some more depth today. But before we jump in, I want to take a moment to describe why health insurance is so critical, particularly to individuals diagnosed with cancer. And so in 2013, researchers from Duke were investigating the financial burden of a cancer diagnosis. And they found that out-of-pocket expenses have a similar impact on someone's quality of life as the physical toxicity of cancer treatment. They termed this financial toxicity. And when we talk about the impact that financial toxicity can have, it's not only for a short amount of time, but also a long-term impact. And so while this may be a newer term, it's certainly not a new issue. And when we talk about financial toxicity, we want to understand what contributes to financial toxicity. And unfortunately, there isn't an easy solution because there are many contributing factors. So some of the factors are employment changes, such as whether you're able to work or not work, as well as if you have access to disability insurance. And then there are common life changes, such as getting married, moving, or being in school. But the primary culprit here is having health insurance. And when we talk about having health insurance, it's not just accessing insurance, but having adequate coverage, as well as effectively navigating coverage to the best way to help you. So that's why we're going to focus on health insurance today. But if you're looking for more information on these different topics and some steps that you can take to try to prevent financial toxicity, I point you to our checklist to avoid financial toxicity. So I know that it looks like a lot on our screen and very small, but what you're seeing here is an example of a few different topic areas that are covered on our financial toxicity checklist. So health insurance coverage, personal issues, employment, and disability insurance. Now, when you actually download the form for free on our website, what you'll see is on the left-hand side, one of these topic areas. So for example, employment and disability insurance. And then on the right-hand side, you're going to see all the resources that Triage Cancer has to help people deal with the answers to these questions. So moving into health insurance today, we know that it is a primary contributing factor to financial toxicity. So it sounds like a pretty easy problem to solve, but unfortunately, it's a bit more complicated because the health insurance situation in the United States can be so complex. So most people don't understand how it works or how to choose a plan. In fact, only 4% of people in the United States that were surveyed could accurately define the four main terms that are used in a policy. So one of the reasons that finding the right health insurance policy can be so challenging is that in order to be an informed consumer, you really have to learn essentially a new language. And there are a lot of studies out there that show that Americans just don't understand health insurance, and we really understand why that is. So I want to put you at ease that if right now you feel like you don't really understand health insurance and how to use it, you are certainly not alone. So with that in mind, I want to set up a foundation that will carry through the rest of our discussion today with defining some core health insurance terms. So first thing that I want to discuss is that most health insurance policies have a network of providers that they've contracted with to provide services at a set rate. So these providers are called in-network providers. If you go to providers within that network, then you'll be charged at that contracted rate. This term is sometimes called allowed amount or contracted amount. What's important to understand is that if you go to a provider that's out of network, your policy may not cover those costs or may cover them at a much lower rate. And then there are terms that are helpful in just assessing your health insurance coverage and how you're using it. So the first term that I want to define is just the cost to have health insurance. So this is named the premium, and it's a fixed dollar amount that you pay every month, whether or not you receive any form of health care. And then there are costs for when you use your health insurance. So the first is a fixed dollar amount, and that's a deductible that you pay each year before your health insurance will even kick in to cover your healthcare costs. And so this really depends on your plan. You could have a $0 deductible, you could have a $500 deductible, or even a $5,000 deductible. The next term to understand is a copayment. This again is a fixed dollar amount, and it's the amount that you pay each time you get a specific type of care. So again, this depends on your specific policy, but if you go to your primary care provider for a checkup, you may pay a $15 copay. But if you're going to a specialist, it may be $50. And then there's the coinsurance or cost share amount. So this is the amount that your health insurance will cover and the amount that you'll be responsible for covering. Again, this depends on your plan, but if you have, for example, an 80-20 coinsurance, then your health insurance is going to cover 80% of your healthcare costs that are in network. So for example, if you have a medical bill of $100, your health insurance would cover $80, and you'd be responsible for the 20% of your coinsurance, or $20. And then potentially the most important term to understand is your out-of-pocket maximum. This is a fixed dollar amount, and it can depend on your plan. But the important thing to understand is that when you reach this amount, your health insurance kicks in and covers 100% of your healthcare costs as long as you're going to in-network providers. Now, there are many different ways to calculate an out-of-pocket maximum and what goes into it, which we'll get into more detail in a bit. But if you were to purchase a marketplace plan, you would have your deductible, your co-payments, and your coinsurance all count towards your out-of-pocket maximum. So now that we've defined the common terms, I really want to put these terms to use. So let's meet Dan. Dan has a health insurance plan with a $2,000 deductible, a coinsurance of 80-20, and an out-of-pocket maximum of $8,000. Unfortunately, Dan was recently in an accident and has received a $102,000 hospital bill, and he's really confused about what he's going to be responsible paying for. So first, he has that deductible. So he has to pay $2,000 of that hospital bill before his health insurance kicks in. So that means there's now $100,000 left of the bill. So then his coinsurance will start, and he's responsible for 20% or $20,000, but he has an out-of-pocket maximum of $8,000. So if he's already put $2,000 towards the deductible, then he owes $6,000 of that remaining $20,000 because $2,000 plus $6,000 meets his $8,000 out-of-pocket maximum. Now, while I'm certainly not saying that $8,000 is a small amount of money, it is less than that total amount of $20,000. If you'd like to hear this again, this is part of our animated video on health insurance basics, and you can also share this information with other people that you think it may be helpful for them to hear. So returning to out-of-pocket maximums, in order to make the most of your health insurance, you really want to know how your plan calculates your out-of-pocket maximum. So for example, in a marketplace plan, your deductibles, co-payments, co-insurance for both medical care and prescription drug coverage all count towards your out-of-pocket maximum. But this isn't the case for every plan. So for example, some employer plans don't include the costs you pay towards your deductible in calculating an out-of-pocket maximum, while other employer-sponsored plans may separate out any prescription drug coverage that you've paid for into its own area. So you're only going to get your co-payments and co-insurance for your medical care counted towards your out-of-pocket maximum. The key here is really to understand what your specific plan counts towards your out-of-pocket maximum so that you can leverage it. So once an individual understands the main terms used in their health insurance, you can start to use that plan in an effective manner to help you combat financial toxicity. But there are a few protections created by the Affordable Care Act that I want to take some time to go over that help manage the cost of health insurance as well. So first, prior to the Affordable Care Act, patients may have had a $75,000 annual limit or even $1 million lifetime limit. And those really aren't hard numbers to reach when we're talking about the cost of cancer care. And the Affordable Care Act said that no lifetime or annual limits could be applied. And then in some instances, health insurance plans would cancel an individual's coverage once they started using the plan. So the Affordable Care Act said that this is no longer allowed as well. There was also some concern with young adults accessing healthcare and having adequate healthcare coverage. So the Affordable Care Act provides protection where young adults are now able to stay on their parents' plan until they turn 26. So while these all help you access health insurance, once you have health insurance, the Affordable Care Act has also provided protections on some types of care that you receive. And one of those protections is receiving free preventative care. The Affordable Care Act has listed very specific services that qualify as preventative care, and you can see the specific list on healthcare.gov. We have the direct link for you here. But typically, when you think of free preventative care, it's the services that you would receive in your annual checkup, like blood pressure checks, immunizations, and some cancer screenings. And when we talk about what is free, we mean that you're not paying a copay, a co-insurance, or your deductible amount to receive this care. So I left out a few potentially important protections that the Affordable Care Act has provided that is especially relevant to an individual diagnosed with cancer. And the first thing is that the Affordable Care Act changed the way that a health insurance company can set that monthly cost that you pay just to have health insurance. And so when a health insurance company is setting premiums, they can now only look at 4 factors. The first is whether you're accessing an individual versus a family plan. And this logically makes sense. If they're covering more people, they can charge you more. The second thing that they can look at is your location, where you currently live. And this is done by your zip code. The third thing that they can look at is your age. However, there is a cap now on how much more an individual can be charged as they age. Previously, there was no cap, so they could exponentially increase the cost, and you may have a drastic change year to year, and now this isn't allowed. And then the fourth and final thing that they can consider is if you use tobacco, they may be able to charge you more. Now, throughout our time together, I'm going to mention that it's also important to know the protections in your state. And this is one example where some states have actually eliminated this. But there's a second protection. And that's that insurance companies can no longer deny you based on a pre-existing condition or your health history or consider your gender or age. There's been a lot of talk about overturning the Affordable Care Act and just keeping this second protection against considering or excluding people because of a pre-existing condition or their health history. However, if you just have this second protection, it has no teeth, and I'll explain why. If you're able to look at my medical history or my current or previous condition and determine how much you're going to charge me for the plan based on that, then you can effectively price me out of the plan so that I can no longer afford it. If I can't afford the plan, it doesn't matter that I could theoretically purchase the plan. So really, we need these two, I apologize, we need these two protections together for it to be helpful. So while we're talking about consumer protections, another important thing to understand that we really wish everyone would use is the right to appeal a health insurance denial. And that's because even if you have adequate health insurance that meets your needs, you're likely going to encounter a time where your health insurance company says no. And what we really want people to understand is that they don't necessarily have to take that no as an answer. As a consumer, we typically have the right to two opportunities to appeal that decision. The first opportunity is called an internal appeal. This is where you go back to your health insurance company and you ask them to reconsider. The second level of appeal, available to people with individual and employer-sponsored plans, is an external appeal. So this takes the decision out of the insurance company's hands. If you're wondering why I'm adding something to someone's plate who is already potentially overwhelmed with several things that they have to do and manage due to a cancer diagnosis, it's because there's data that shows between 40 to 60% of health insurance appeals are found in favor of the individual patient. And so what that means is that roughly 50% of the time, the health insurance company is getting it wrong when they deny coverage. And this is really important to understand because while we've just made a case for why it's an incredibly valuable tool, unfortunately, consumers are rarely appealing their denied claims. So less than 0.2% of all denied claims get appealed. And when we're talking about accessing care and combating financial toxicity and using your health insurance to your benefit, this is an extremely underutilized tool in your toolbox. So for that reason, we really emphasize denials. And because of that, we've created a myriad of resources to help individuals deal with appeals. These are available for free on our health insurance topics page on our website. And there are several different types of resources. So you have our quick guides, you have animated videos, as well as some more in-depth resources on cancer finances and recorded webinars. So we've talked about how we pay for healthcare, but we really haven't addressed how your health insurance company pays for your healthcare. And there are typically two different types of payment systems in the United States. So the first is fee for service. And this is where you go and you get a particular medical service, say an MRI, and then your health insurance company pays the fee for that particular service. A good example of this is Original Medicare, where you go to a provider who accepts Medicare and Medicare is going to pay directly for that service. And then the second type of structure is managed care. And these are where plans contract with a network of providers, where before we were talking about in versus out of network providers, and they agree upon the cost that they will pay for certain types of care. These plans are structured to reduce cost and hopefully increase the quality of care. So when we talk about managed care plans, there are actually several different options, but there are three common types. And each type of plan uses a network of physicians, hospitals, and other healthcare professionals to give you the highest quality of care. But there are a couple of key differences that you want to keep in mind when you're choosing a health insurance plan to best fit your needs. So the first at the far end of one end of the spectrum is an HMO, or a health maintenance organization. And typically this is categorized by a few things. You're going to be required to have a primary care provider, and you're going to need to visit that primary care provider in order to get a referral to a specialist. There are some exceptions in emergency situations and for an individual to see an OBGYN. You're also usually talking about lower costs, so a lower monthly premium, but a smaller network of providers is typically available to you. At the opposite end of the spectrum are PPOs, or preferred provider organizations. And these don't require a PCP, a primary care provider, and they typically have a larger network of providers, so you have more choice. They may also have some out-of-network coverage, but these can typically come with higher monthly premium. And then there's the middle of the road. So these are exclusive provider organizations, or EPOs. They're kind of a mix between two plans. They follow a PPO in that they may have a larger network of providers and a primary care is not necessary, but they don't typically have out-of-network coverage. So when we talk about accessing our health insurance options and comparing what plan may be best for us, it's helpful to understand where we can even receive health insurance. So in the United States, there are only 3 places where we get our health insurance coverage. We're either getting it directly from an insurance company, through the government, and what I mean by this is Medicare or Medicaid, or through an employer. And actually, about roughly 50% of people in the United States get coverage through their employer. And in fact, under the Affordable Care Act, a requirement was created that everyone had to have health insurance. If you did not have health insurance coverage, you faced a penalty. In December of 2017, however, Congress passed a budget resolution where they lowered the penalty for not having health insurance coverage over time to $0. So while the requirement is technically still in existence, the penalty has been dropped to $0 since 2019. But again, this is where it's important to understand your state rules, because some states have recreated this individual mandate at the state level, and we've listed them on the slide so that you are aware of this change. Now, if you remember, the little pyramid had the 3 different ways to get health insurance. One of the main ways, because approximately 50% of people access health insurance this way, is through their employer plan. But that raises a question of what if someone has to leave their job and therefore lose access to their health insurance coverage, or even if they have to lower their hours to the point where they're no longer eligible through their employer's policy. And this is where COBRA may be helpful. COBRA is the federal law that allows eligible employees to keep the exact same coverage that they had when they were employed. So an eligible employee is someone who works for an employer with 20 or more employees, or is a state or local employee of any size. If someone is employed by the federal government, then they may have rights under a different law. Now, the benefit of COBRA is that it's the exact same plan. And what I mean by this is that your providers and your medications will be continued to be covered in the same way that they have been. But sometimes people are concerned with the cost to keep COBRA, and that's because you are now responsible for 100% of the monthly premium. So what that practically means to you is that if you've only been paying a portion of your premium and your employer had been responsible for the other part of the premium, you're now responsible for the full amount. And then sometimes there's a 2% administrative fee. So this can get rather expensive, but there could be some financial benefit depending upon how you've used your health insurance and even potentially where you are in the year. So what I mean by this is that because you're keeping that same exact plan, if you've met your deductible and out-of-pocket maximum for the year, and you're going to in-network providers, then you know that your health insurance coverage is going to cover your costs for the remainder of the year at 100%. So practically speaking, that means the only cost that you're going to have is paying that monthly premium. This is different than if you were to switch plans to either a spouse's employer-sponsored plan or picking up a plan in the marketplace, because you will have to start over and meet that plan's deductible and out-of-pocket maximum. So if you are considering COBRA, it's important to know how long that you could keep the benefits for. And I just want to pause and say that often I'll refer to it as COBRA coverage, and that's a bit of a misnomer because COBRA is really just the mechanism that allows you to keep your employer-sponsored plan. So while I may be referring to it as COBRA coverage, it is in fact employer-sponsored plan that you had. There is no one plan for COBRA. And the answer of how long you can keep your coverage under COBRA depends on the qualifying event that led to you being able to access COBRA. So if your employment ends or you are losing eligibility because your hours have been reduced, then typically you can keep COBRA for up to 18 months. If instead your qualifying event, for example, is that you're aging out of your parents' policy, so you're turning 26, you would be able to keep COBRA for up to 36 months. There are a few circumstances where COBRA coverage may last longer. So the first is a disability extension. And this occurs if you've elected COBRA coverage and the Social Security Administration determines that you are entitled to disability benefits anytime during that first 60 days that you were covered by COBRA. So if this occurs, you can get an extension for up to 11 months for a total of 29 months. The purpose of this is to try to bridge the gap between losing your employer-sponsored health insurance and being eligible for Medicare. Now, there are a few steps that you need to take. You need to notify your plan administrator or COBRA benefits person about this determination, and that has to happen before the expiration of your 18-month premium, 18-month coverage, I apologize. Now, your premiums can also be increased up to 150%. The second type of circumstances where COBRA can last longer than 18 months is when you may qualify for another qualifying event. And in that case, you may be able to get a total of 36 months of COBRA coverage. So there are circumstances where COBRA can end early. So if you stop paying your monthly premium or if you commit fraud, then your COBRA coverage will end. Another one that often surprises people is that if your employer goes out of business or stops providing all employees insurance coverage, then your COBRA coverage is going to end. And that's because COBRA allows you to continue the coverage that your employer is offering. If there is no plan to offer, then there's no plan for you to access. So in order to elect coverage, you have a limited amount of time under COBRA. So you have 60 days from your qualifying event to elect COBRA coverage, and you can potentially wait until the end of that time period, and your coverage will go back to the day of your qualifying event. But you'll have to pay those monthly premiums back to that date. Another thing that we often hear from people is that they're overwhelmed because they think they have to elect COBRA for themselves and all of their dependents or family members. And that, in fact, is not accurate. Instead, the employee and their dependents can all make different decisions. So if you are diagnosed with cancer and your employer-sponsored plan is meeting all of your needs, and you're having a difficult time, for example, looking in the marketplace to find insurance that meets those needs, then you could elect COBRA, and your spouse and your children could go either elect COBRA on not elect COBRA, find another plan on the marketplace that provides them the coverage they need, and it may be a cost savings for you. So as I discussed, COBRA only applies to employers of 20 or more employees or state or local government workers. So you may be wondering if there is access if you don't fall into that category, and it depends on your state. So some states have COBRA laws, and these rules vary greatly depending upon which state you live in. So we have state-specific information on our chart of state laws. And as an example of how to read this, if you look at towards the middle where it says 12 months and you find Illinois, this means that Illinois state law allows for 12 months of a continuation of coverage. So moving from receiving health insurance through your employer, the next level on the pyramid was government-funded health insurance. And one example is Medicare. Medicare is available to individuals who are 65 or older, receiving Social Security disability insurance payments for 2 years, or if you are diagnosed with end-stage renal disease or ALS, you automatically qualify for Medicare. If you are looking for more information specific to Medicare, we have a brand new resource hub that has collected all of our various resources on Medicare on one page for you to look at. And we recently had a webinar called Medicare an In-Depth Look, and you can access the recording on this web page as well. So another example of government-funded health insurance is Medicaid. And while Medicaid is a federal program, it's administered at the state level. And so practically what this means for anyone considering Medicaid is that the rules and the programs are very state specific. Now, one of the confusing parts of Medicaid is that it's not referred to as Medicaid in every state. So for example, while New York State sticks with the word Medicaid, in Connecticut, their Medicaid program is Husky Health. And in Massachusetts, it's Mass Health. And then in Washington, it's Apple Health. So prior to 2014, individuals could only access Medicaid if they showed, I apologize for my dogs, if they showed that they had low income and low resources. And when we talk about resources, we mean assets, as well as meet another category of eligibility. So for people in the cancer community, they often could get access to Medicaid through the Aged, Blind, and Disabled program. We understand that's not the best name for a program, but what's important to understand is this creates a lot of hoops for someone to access Medicaid. And that's because, practically speaking, an individual would have to go to the Social Security Administration, apply for supplemental security income, be approved for that program, and then qualify for Medicaid. So it's a lot of barriers to accessing healthcare for someone in the cancer community. Now, the Affordable Care Act created a fifth door of eligibility, and this door is just based on income. So it's your income for your household size, and you have to be 138% below the poverty level. So to be eligible for Medicaid. And what's important to understand here is individuals who fit through this door do not have to meet an asset test or one of those other categories. However, unfortunately, Medicaid expansion, this fifth door just based on income, was made voluntary for states to participate in. So in expansion states, the old door still exists, but someone could also go through that fifth door. But in states that have not expanded, they still only have those original 4 doors. So because Medicaid expansion was voluntary, this is what it looks like as of today. The states on the left have chosen to expand access to their programs, so individuals may be able to access Medicaid through that 5th door. And the states on the right have not expanded access to Medicaid, and they represent about 3 to 5 million people who may have had access to coverage, but haven't because their states have chosen not to expand. So as a reminder, that means they have to show low income, resources, and fit through another door. So if you don't have access to an employer-sponsored plan and don't qualify for a government-funded plan, what are your health insurance options? Well, the Affordable Care Act created an additional way to access health insurance through the creation of the state health insurance marketplaces. And this on our little pyramid here is that top part. And this essentially allows people to go online and shop for health insurance plans that are sold by private insurance companies. When we speak to people, people often express a lot of hesitance about state health insurance marketplaces, sometimes referred to as Obamacare, because they have concerns that they're government-funded plans, and that, in fact, is not the case. They are private insurance companies. But in addition to them being private health insurance plans, there are some benefits and protections of buying a health insurance plan through the marketplace. And one of those benefits is that all plans sold in the marketplace have a cap on an out-of-pocket maximum. So for this year, it's $8,700 for an individual plan. While I understand that sounds like a lot of money and is in fact a lot of money, it is lower than some of the out-of-pocket maximums that we've heard employer-sponsored plans have. Another benefit of looking at plans in the marketplace is that you may qualify for financial help. And there are 2 types of financial help. The first is referred to as a premium tax credit. And this is based on your income, and you may qualify for assistance that lowers that monthly premium amount that you're going to pay. The second are cost sharing subsidies. And these reduce the cost of things like co-payments and coinsurance. And again, it's based on your income. And then when you're looking at the marketplace plan, the plans are also standardized. So what I mean by this is that they are assigned metal levels, bronze through platinum. And this is a quick way for you to identify what that cost share or coinsurance amount is going to be on the plan that you're picking. So every platinum plan, for example, has a 90% coinsurance, meaning your health insurance will cover 90% of in-network costs and you'll be responsible for 10. This goes all the way down in metal level to bronze, where those plans, the health insurance company is going to cover 60% of in-network costs and you're going to be responsible for 40%. Now, what this practically means for you is that typically as you go up in metal level, your monthly premium goes up, but your out-of-pocket expenses typically go down. And at the bottom of this screen, I apologize. At the bottom of this screen, there is something called catastrophic coverage. These are plans available in the marketplace for individuals under 30, but it isn't full health insurance coverage. So we often suggest some hesitancy before electing this. So here is how financial assistance in the marketplace works in a state that has expanded Medicaid. If you're below 138% of the poverty level, then you have access to Medicaid. If you are between 138% and 250% of the federal poverty level, then you have access to both premium tax credits that amount to lower the monthly cost, as well as cost sharing subsidies. The key to accessing cost sharing subsidies is not only your income, but it is only available if you select a silver plan. If you're between 250 and 400% of the federal poverty level, then you have access to premium tax credits. Now, if you are above 400% of the federal poverty level, you can still purchase a plan through the marketplace, but you may not have access to financial assistance. Again, in some states, this may be different, and we'll talk about another rule in a bit as well. So for states that are not expanding Medicaid, you don't have access if you're 138% below the poverty level to receive Medicaid. You do qualify for cost sharing subsidies in the marketplace. However, you don't have access to the premium tax credits. So practically speaking, what this means is you can purchase a plan for full price and then receive help with paying for the costs of your care. But that's not really helpful if you can't afford to even access the plan. So what this means practically is that now we have this disparity where someone with 110% of a federal poverty level income, for example, can't reach access to get that lower monthly premium, but individuals at 375% of the federal poverty level can access that assistance. And unfortunately, this wasn't intended by the law. So in additional news, the Inflation Reduction Act provided a few additional assistance opportunities for individuals. So if you have an income of 138 to 150% federal poverty level, you may be able to access a plan in the state health insurance marketplace for $10 or less a month. Additionally, individuals who are at 400% federal poverty level or above can get help reducing the monthly premium to lower that amount to 8.5% of their household income. This will continue through 2025. So now that we've discussed accessing the marketplace and that you may qualify for assistance based on your income and household size, it's helpful to understand who to include in that household size. So you include yourself, your spouse if you're married, children who live with you, even if they file a tax return, and anyone included as a dependent, even if they don't live with you. And you only include an unmarried partner if they are your dependent for tax purposes and they are a parent of your child. Now, you don't include unmarried partners' children if they're not your dependents, or your parents or other relatives who live with you if they file their own tax return and aren't considered your dependent. So now that we've established what to include as your household, we need to determine how to project or predict your income in the marketplace. And when we're talking about applying for a plan in the marketplace, the income is called Modified Adjusted Gross Income, or MAGI. And this isn't typically a number that someone's going to know off the top of their head. And that's because if you were to look at your W-2, for instance, that number you're not going to find on there. Instead, you have to do some math. And on the screen, you'll see the categories that are included in MAGI to help you determine what your MAGI is. So it's really important to estimate the income that you're going to be receiving for the year accurately. And you also need to report any changes that occur to your income or household size. The law requires that you make any changes within 30 days, and this allows the marketplace to verify those changes and redetermine your eligibility. Practically speaking, you may wonder why I said this was so important to do, and that's because a change in your household size or income can affect the financial assistance or your eligibility in the marketplace. And if you don't report these changes and end up getting more financial assistance than you are entitled to, you will be responsible for paying that money back. So there are multiple ways to enroll in a marketplace plan. So you can go to healthcare.gov, and it's a good starting place for people. Many states have their health insurance marketplace on this site. The states that have their own website, you can still connect to by starting at healthcare.gov, because when you select your state, for example, New York, it will automatically put you over to that appropriate website. Now, there are people who don't have access to the internet or are really wary of putting that much information about themselves online. So you have a few different options. You may be able to call the toll-free hotline. You could fill out a paper application and mail or fax it in. And then in most places, there is in-person assistance with enrolling. And these are called marketplace assisters. Marketplace assisters were created because the Affordable Care Act included funding for in-person assisters. These people are trained in the marketplace, understand the plans in your area, and are able to help you one-on-one navigate choosing a plan that meets your needs. Healthcare.gov has a tool where you can locate an assister based on your zip code. But when you put in your zip code, it's not just going to show you assisters. It's also going to include agents and brokers. And it's important for you to know the difference between the two. As I said, assisters were partly funded through the Affordable Care Act. And that means that they are not going to have a biased opinion in terms of helping you pick a plan, because they don't benefit on the plan type that you pick. They're independently paid. However, agents or brokers often have a vested interest in the plan that you pick, because that's how they're going to get paid. They get paid by the insurance company when they sell that insurance company's plan. If you would only like to speak to an assister, you have to just select them. So with all of these options, we often get surprised looks when people learn that they can't enroll in a plan at any time. So when you can enroll in coverage is going to depend on what type of coverage you're trying to enroll in. So for example, state health insurance marketplaces are calendar year plans. They go from January 1st to December 31st. So open enrollment periods for each year are typically in the fall. So when you're looking for a 2023 plan, open enrollment begins November 1st. If you pick a plan on November 1st, it's still not going to start until January 1st. Medicare also has open enrollment and is also a calendar year plan, and that begins October 15th this year. Dissimilarly, Medicaid applications are accepted year-round, and then employer-sponsored plans really vary. Often their open enrollment periods are in the fall, but if you're looking for more information, then you can go to your HR or employee benefits coordinator. Now, there are some instances where you may be able to access health insurance outside of open enrollment. And the Affordable Care Act recognized that changes don't just occur in someone's life during open enrollment, and so special enrollment periods were created. So an example of a special enrollment period is when you lose health insurance coverage or you have a life-changing event, such as a change in residence. However, cancer diagnosis is not considered a qualifying event for special enrollment period, and neither is if you lose coverage because you are no longer paying for it. So other examples of life-changing events are changes in your family makeup. For example, having a child or getting married. And you have 60 days from the triggering event to enroll in a plan. So I want to pull together everything that we've discussed so far. So when someone's losing access to employer-sponsored health insurance, they now have more options than they ever have in the past. So one lane or option that someone could choose to drive in is electing to continue their employer-sponsored health insurance through COBRA or state COBRA. The second lane would be to go into the marketplace and pick a plan and purchase a plan there. A third potential option is another group plan, either a spouse's plan, a parent's plan, or some schools or associations have plans as well. However, what you need to learn about these options is whether they have a special enrollment period and what would trigger that special enrollment period. So in order to learn about this, you could go to the employee benefits coordinator or HR. And then if circumstances have changed, an individual may now be eligible for Medicaid or Medicare. What's really important to understand is that you can't switch between these lanes until the next open enrollment period, unless you are picking a marketplace plan and you're going to have a gap in coverage from when your employer-sponsored plan ends and your marketplace plan begins. In this instance, you can elect a marketplace plan and pay for it, and then go to your employee benefits coordinator or COBRA administrator and indicate that you would like to elect COBRA only until your marketplace plan begins. The key to this is you have to get that marketplace plan first. So because we've given you just a brief overview today, I do want to point you back to our resources on your options when losing employer-sponsored health insurance. So we have an animated video as well as a quick guide. These are available for free on our website, and they are available in English and Spanish. So now that we have an understanding of the terms that are commonly used in health insurance plan and a wide array of the options that are available to us, we want to make sure we're appropriately picking a plan that meets our needs and helps us avoid higher out-of-pocket costs. So when you're talking about the state health insurance marketplace, if you go to their website, specifically the one on the screen, you can actually start to look at your health insurance options. So if you put in your zip code, you'll receive plans that are available. If you add in your age, household size, and estimated income, you can also see what financial assistance you would qualify for. So when you're accessing health insurance, the health insurance marketplace online, there are also ways to filter the plans based on what your preferences are. So your monthly premium, the health plan categories, as we discussed, that metal level of how much the co-insurance will be, the type of insurance company, if you have a preference, as well as the health plan types that we discussed. Do you want a broader network with PPOs, or do you think an HMO might actually meet your needs? So when we have all of these options, it's important for us to compare these options to make sure that we're getting the plan that best suits our needs. So when we're talking about comparing a plan, we don't just want to look at the monthly premium, whether it's a marketplace plan to an employer-sponsored plan, to employer-sponsored plans, or really any variation in between. So I want to put this to practice. There are 3 plans available for you for next year. The first is a bronze with a monthly premium of $200 and an out-of-pocket maximum of $8,000. Slightly more expensive is that silver plan with a $275 premium and an out-of-pocket maximum of $6,000. And then at the top of your options are a platinum plan that's going to cost you $400 a month, but has the lowest out-of-pocket maximum at $2,000. And what we need to know is, can you tell just by looking at these plans how much they're going to cost you by the end of the year and which option will actually cost you the least? And this isn't a trick question. The answer is right on the screen. It's no. You actually have to do the math. And the way you do the math is you take that monthly premium and you multiply it by 12. So for example, $200 by 12 is $2,400. And then you're going to add it to the out-of-pocket maximum. Because if you're going to in-network providers, and we're assuming if you have a cancer diagnosis, you're meeting your out-of-pocket maximum, then you know the total cost for you for the year is going to be, after that out-of-pocket maximum is met, covered by your other health insurance costs. If you go in-network, will be covered 100%. So the total that you're going to get for the bronze plan is $10,400. But if you look at this platinum plan, the total is actually $6,800. So even if you initially got sticker price at the platinum plan's monthly cost, it ends up saving you almost $2,000 over the course of a year. Now, we certainly don't want people just to look at cost. We just want them to understand that there's more than just the monthly premium when you're discussing cost. But there are other factors that you need to consider so that you don't have surprises when you go to use your health insurance. So one is making sure that your network of providers and facilities are covered by the plan you choose. The next thing to consider is the prescription drug coverage. Sometimes people are surprised that each health insurance plan can have a different formulary. And what a formulary is, it lists the different drugs that are covered, as well as how much they're covered. And sometimes there are management techniques by insurance companies to try to lower the cost. So you need to understand if you're going to need to get a prior authorization or if they require step therapy. So starting at a lower level drug and working your way up to the higher drug. And again, if there are separate out-of-pocket costs, particularly when we're talking about your out-of-pocket. So when you're looking at marketplace plans, you can actually search for your doctors and facilities as well as your prescription drugs, but we don't suggest that you just rely on this tool. You want to double check with your providers, and you don't want to ask them if they accept an Obamacare plan. Instead, you want to use the specific name that's in front of you on the screen. So for example, if you have two Blue Cross Blue Shield plans in front of you, you don't want to ask them if they just accept Blue Cross Blue Shield. You want to give them the full name of the policy. You also can check a hospital's website for a full list of plans and let your providers know that you're changing insurance so that there's a smoother transition. We have several resources available on our website that recap what we've discussed, including our animated video on picking a health insurance plan. Now, what I want to actually do now is pull everything together that we've discussed in our time and walk through our health insurance comparison worksheet. So let's meet Eloise. Eloise is trying to figure out her health insurance options. She has insurance through her employer, but she worries it may cost too much. She also found a plan on the marketplace that covers her prescription drugs and healthcare providers. She's wondering which plan will cost her the least, assuming that she hits her out-of-pocket maximum during the year. So we want to help Eloise make this determination. So this is a screenshot of our health insurance comparison worksheet that you can access online, and this is the beginning of the worksheet. It allows you to put in your plan information, as well as some of those relevant factors that don't necessarily come with a number. So the type of plan, your primary care providers being covered, hospitals, and then your prescription drugs. So Eloise fills this in and she places the marketplace plan as option number 1. It is helpful to note that this is a PPO, so she will likely have access to a broader network of providers. And it does cover the primary care physicians, hospitals, and prescription drugs that she's currently seeing. In comparison, her employer-sponsored plan is an HMO, so it has a smaller network provider, but again meets those other needs. So now she needs to consider the math part of this to determine which is going to cost less over the year. So her marketplace plan has a $450 monthly premium with a deductible of $5,000. The coinsurance is 70%, and her out-of-pocket maximum is $8,200. The monthly premium in comparison for our employer plan is $357. They have an out-of-pocket maximum of $5,000, a higher coinsurance of 80%, and a lower deductible for not deductible, out-of-pocket maximum of $7,500. However, there's a separate out-of-pocket maximum for prescription drugs of $5,000. So now we need to consider what the total cost is going to be to her. And at the end of our worksheet, we have 3 different formulas that help you accurately determine the cost of the plan. So the first option is a marketplace plan. And we're going to use this third formula here because the out-of-pocket maximum in a marketplace plan includes the deductible and prescription drug costs, all within one out-of-pocket maximum. So first we take $450 and we multiply it by 12. Then we add her out-of-pocket maximum for the marketplace plan and we get $8,200. So her total for option 1 is $13,600. Then we use a different formula for option 2, the employer-sponsored plan, because that does not include in her out-of-pocket maximum prescription drug costs. Instead, that's a separate cost. So we do the $357 times 12 just to get the total cost to have the plan. The $5,000 for the out-of-pocket maximum for prescription drugs, and the $7,500 for her other out-of-pocket maximum. When you do this math, it's $784 for the year. So even though there were some potentially luring numbers when you didn't do the math, like it being a higher cost share as well as a lower monthly premium, her employer-sponsored plan actually costs her more over the course of the year than that marketplace plan, which is why it's so important to actually take the time to do the math and make sure you're using the correct. So now that we've talked about how to pick a plan that works best for you and all the different options that may be available, it's important to understand you don't want to pick a plan and stick with it. Instead, you want to be reviewing your plan at least every year, or also if you're changing jobs. And we have a checklist if you are looking for a job that helps you consider what you may want to look at in employee benefits during a job search. You also don't want to just look over your health insurance, but other benefits that are offered through your employer. And we have a checklist to help you consider those things as well. So the unfortunate news is that picking the right plan is really only half of the battle. And so once we have a plan, we want to make sure that people are making the most of their plan. And there are many ways to do this, some of which we've touched upon. So you want to use in-network providers where possible. You want to appeal those denials of coverage, and then you want to leverage your out-of-pocket maximum. And I'm sure you're sick of hearing me say this word by now, but it is really critical to understand that out-of-pocket maximum and use it to your benefit. If you've been putting off some medical care because of the cost, but you've reached your out-of-pocket maximum for the year and those medical procedures that you've been putting off are in network, then maybe now is the time to go get them because they'll be covered at 100%. The last thing I want to mention is it's important to pay attention to your medical bills. And oftentimes people are surprised to hear me say this, but medical billing is a human process and inevitably comes with some errors. So you actually want to review the bills that you receive to make sure you're billed for what you actually received care-wise. And we have several different resources that can help you with this on our website, including a recorded webinar.
Thank you so much, Nicole. We have been answering questions in the chat box in the Q&A, so I don't think that there are any that you need to answer out loud. So as a reminder, for those of you who are seeking continuing education units, there are some things that you need to do. Please make sure that you have listened or not, excuse me, please make sure that you have